The main change will be the need for coordinated regional networks of care with more stringent provisions for reperfusion and reperfusion delays. We recommend the radial approach if the operator is experienced, drug-eluting stents over bare metal stents if the patient is not at high risk of bleeding. We've upgraded the novel antiplatelet agents such as ticagrelor and prasugrel, and we generally recommend 1 year of dual antiplatelet therapy, a strict minimum of 1 month if the patient has had a bare metal stent, and 6 months if the patient has had a drug-eluting stent. We continue to emphasize very stringently the need for aggressive risk factor management, smoking management, lipid-lowering therapy being instituted at day 0 using a high dose of a potent statin.
In the TRILOGY-ACS trial, patients with acute coronary syndrome that was not treated by revascularization were randomized to receive on top of aspirin either clopidogrel 75 milligrams daily or prasugrel 10 to 5 milligrams daily. More than 9,000 patients were followed for an average of 17 months.
What we found was a 2% absolute difference in favor of prasugrel, but it was not statistically significant, so this is a neutral trial. We find that at about a year, the curves started separating. In the primary endpoint, beyond a year, the trial was significant. Up to 30 months, there were similar rates of bleeding with clopidogrel and prasugrel.
The use of intra-aortic balloon counterpulsation in acute myocardial infarction complicated by cardiogenic shock is widely used despite limited evidence. IABP-SHOCK 2 is the largest study to date to test the use of IABP in acute myocardial infarction complicated by cardiogenic shock in a randomized manner. 600 patients in cardiogenic shock at sites throughout Germany were randomized to either IABP or conventional optimal medical treatment alone.
The primary study endpoint was 30-day mortality, what we were looking for, and we had a 39.7% mortality in the IABP arm and a 41.3% mortality in the control arm. And this was not statistically significant with a p-value of 0.69. This is the largest randomized clinical trial which has been performed so far in cardiogenic shock, and unfortunately this trial was negative, showing that the intra-aortic balloon pump cannot improve the survival or any of the secondary study endpoints, and this will probably impact guidelines and will probably impact the clinical practice.
FAST-MI analyzed data from 4 French nationwide registries of STEMI conducted 5 years apart and found a 68% decrease in mortality over the last 15 years.
From our data, we can draw 2 main practical messages. The first one is that the public campaigns on the recognition of heart attacks were successful. The second one is that the increased proportion of younger women is really striking.